everyone, so today I would like to present a topic entitled Autism and Asperger Syndrome. What is autism spectrum disorder? So autism spectrum disorder are characterized by severe and complex impairments in reciprocal social interaction and communication skills, and by the presence of stereotypical behavior, interests, and activities. So, autism usually begins before 3 years of age, and the deficits will persist throughout life. And autism often coexists with neuropsychiatric disorders, including seizures, ADHD, affective disorders, OCD, and Tourette syndrome. And the behavioral characteristics of autism are very critical to the diagnosis of the disorder, and the behavioral characteristics can be categorized into 4 subclusters. And the first one is disturbances in social interaction, the second one is disturbances in communication, the third one is disturbances in behavior, and the last one is disturbances in sensory and perceptual processing and associated impairment. For the disturbances in social interaction, it will affect the child's ability to establish meaningful relationships with people and inanimate objects, and the child will also struggle with poor eye contact, failure to develop peer relationships, inappropriate facial expression, and lack of social reciprocity. Meanwhile, for the disturbances in communication, it is basically for the delay of speech, and it consists of continuum from mild to severe. And for the mild one, it characterized by normal language accompanied by slight articulation or tonal deficits. And for the severe one, it characterized by complete lack of speech or mute. And there are also other communication problems, including repetitive and echolalia. And there are 2 types of echolalia, which is the first one is classic echolalia, and the second one is delayed echolalia. And for the classic echolalia, it consists of apparent-like repetitions of phrases immediately after the child has been exposed to them. And for the delayed echolalia, it characterized by the repetitions of phrases at a later time and usually occur out of social context. Next is disturbances in behavior, and this can be seen in intolerance of deviation from routine, resistance to any type of change, and patterns of behavior that are best categorized as stereotypical, perseverative, lacking of representational or pretend play, and bizarre attachment to unusual objects. These disturbances also include deviant motor patterns, which is involving the hands, the arms, trunk, lower extremities, and upper extremities. For example, the wiggling and flicking of the fingers, the head rolling and banging, body rocking and swaying, and so on and so forth. Last but not least is the disturbances of sensory and perceptual processing. So these involve abnormal responses to various types of senses. For example, children with tactile hypersensitivity dislike touching the sand, and so on and so forth. And for the associated impairments include intellectual impairment, seizure disorder, and the discontinuities of developmental rates. Moving on to the comprehensive intervention of autism. These include parental counseling, behavioral treatment, special education in highly structured environment, speech language therapy, sensory integrative therapy, social skills training, medication, family support, and various types of therapy, including discrete trial training. Moving on to Asperger syndrome. So it is characterized by significant disturbances in social interaction and nonverbal communication, combined with restricted and repetitive patterns of behavior and interest. Next is the essential features of Asperger syndrome. The first one is severe and sustained impairments in social interaction and the development of restricted and repetitive behavior, interests, and activities. The second one is the interference with functional daily living skills must be significant, and also it must show typical cognitive development and age-appropriate self-help skills or adaptive behavior aside from the impairments in social interaction. Last but not least is the treatment for Asperger syndrome. This includes supportive and symptomatic intervention, which include special education programs, social skills training, and vocational training, and so on and so forth.